Welcome to 2024 Journal Club. This month's article is Having a Child with Cancer, African Mother's Perspective by Naidu et al., published in South African Journal of Occupational Therapy in 2016. So the study was conducted by final year occupational therapy students in Durban, KwaZulu-Natal, South Africa. In this study, Naidu et al. Looked at the experiences and psychological challenges faced by mothers with children who have childhood cancers. Here is the graphic for this article, following the order of the article, starting with the introduction, methods, results, and conclusion. Now let's look at the introduction. According to the Childhood Cancer Foundation of South Africa, 1 in 600 children will have cancer before the age of 16. The symptoms of childhood cancers are difficult to identify as they may mimic other common illnesses and conditions to which children are prone. For example, a child may present with bleeding tendencies, yet the underlying cause is cancer. While it is possible to treat 80% of childhood malignancies, Stefan reported that the cure rate for children with cancer is lower in low-middle income countries, as the condition is often underreported. Also, communication around cancer as an illness is limited to medical matters, with emotional issues being neglected. Despite the prevalence of childhood cancer in South Africa, there is limited literature around the experiences of parents who have had a child with cancer. Healthcare professionals need to identify and provide intervention for the psychological difficulties of the family when a child is diagnosed with cancer. Furthermore, the diagnosis of childhood cancer is described as one of the most intense and painful experiences that a parent can have. Parents have reported feelings of distress, shock, coping difficulties, and emotional pain as part of the psychological impact of the diagnosis. Parents of children with cancer are considered the untreated patients, owing to the high levels of anxiety and stress experienced and the continuous fear of relapse. Psychological problems may be difficult to assess or identify as they overlap with many everyday problems and challenges. However, it is crucial for health professionals to be able to identify and provide intervention for the psychological difficulties of the family that may ensue the wake of a cancer diagnosis. So the aim of the study was to explore the experiences and psychological challenges faced by mothers with children who have childhood cancers. The researchers further wish to explore the occupational effects of having a child with cancer and coping mechanism used by the mother. They also aimed at creating deeper insights to guide clinicians for provision of intervention. Now let's look at the methods that the authors used to gather data. So this was a qualitative cross-sectional research design to explore the lived experiences of mothers with children who have childhood cancers. So let me just explain a cross-sectional. So with cross-sectional, you collect data from different individuals at the same point in time, and the lived experiences is first-hand involvement or direct experiences. Then Coming to purposive sampling, participants are deliberately selected because they have the characteristics that are of interest to the researcher. So participants were selected through purposive sampling. They were chosen to participate if they were caregivers of a child less than 18 years of age, if they spoke English or isiZulu, and if they were a resident at a children's hematology oncology clinic in Durban, KZN. So 6 mothers were participated. They were between the ages of 24 and 42 years old, and all had 2 to 5 other children who remained at home. Data were collected in 1 focus group and 2 semi-structured interviews. All 6 mothers participated in the focus group. They were all invited to be interviewed and 2 volunteered. The interviews were used to deepen the understanding of the themes of interest that emerged from the focus group. So a focus group is a small group of similar people who share common interest. Now let's look at the results. So the data was analyzed using thematic analysis. Maybe you want to know what is thematic analysis. So thematic analysis is a method of analyzing qualitative data that involves reading through a set of data and looking for patterns in the meaning of the data to find themes. Deductive and inductive reasoning were used to generate initial codes and then to reduce the codes into main themes. Let us briefly explain deductive versus inductive reasoning. The difference between inductive and deductive reasoning is that inductive reasoning begins with an observation, supports it with patterns, then arrives at the hypothesis or theory. Yet with deductive reasoning, it begins with a theory, supports it with observation, and eventually arrives at a confirmation. I hope you understand the difference now. So 4 main themes were identified: emotional reactions to having a child with cancer. Mothers expressed guilt and anxiety. They blamed themselves for their child's diagnosis. They felt guilty about leaving family at home and anxious regarding their child's treatment. They were frustrated by their lack of knowledge and support by their disrupted occupational roles at home. Theme number 2, community insights and beliefs. All mothers had a traditional African belief paradigm, seeing cancer as ill will or a curse. All had consulted traditional healers first. Their communities did not acknowledge that their child had cancer, leaving them feeling alone. Third theme, factors that promoted resilience in mothers. The mothers had support from their family at home and from being at CHOC. Examples of coping mechanisms were prayer, acceptance, and optimism. Theme number 4, impact of mothers' occupational roles. All mothers were unemployed. Their occupational roles revolved around looking after their homes and gardens. Other family members had to take on their mothers' roles, leaving them feeling distressed and guilty. Now, let's look at the conclusion. The researcher highlighted the emotional and occupational impact that having a child with cancer has on mothers in KZN. There is lack of knowledge in rural and peri-urban areas about cancer and little support from the communities. This research showed that families are likely to experience disruption to their family lives when the mother needs to accompany her child with cancer. Now, as you go to your discussion let us look at these questions. The findings are reported on page 2 and 3 of this article. Find a mother's quote that shows her feelings of guilt and anxiety. Question number 2. As above, find a mother's quote on page 3 that provides an example of a mother's coping mechanism. On page 3, a mother who was given the name Eunice expresses her distress over her oldest child at home. What is her distress about? Question number 4. On page 5 of this article, the authors describe Ubuntu. How do they relate this value to the mother's occupational roles at home? And the last question, look at figure 1 on page 5 and read the paragraph below it. Discuss what the shift in the mother's responsibilities does to families' occupations. Thank you very much. I hope you have learned something from this article. Thank you. Bye-bye.